This is Dr. Cruz at Kentuckiana Integrative Medicine, and we're interviewing Jacob Beard. He's a 31-year-old gentleman who came to us with the diagnosis of Hodgkins Lymphoma approximately a year ago. Jacob, is it okay if we put this on the internet and on our website, this interview?
It is.
Great. So tell us a little bit about your journey.
So in May 2023, I was diagnosed, as you said, classic Hodgkin's lymphoma. I was prescribed a 6-month chemo treatment to combat the disease, and upon discovering this, I'd already obviously been with your all's office for some time, receiving the Myers cocktail, and basically took a break from it for a time period. I didn't think ultimately that obviously money during these times is not
Abundant, because you're not working, you're taking care of your health.
And ultimately we ended up taking a break, as we said, and it was about 4 or 5 treatments in, I had not received the Myers cocktail, and noticed that I was definitely struggling in my recovery with the chemo. It was taking longer than 2 or 3 days for me to kind of turn it around. And on the 5th, came back and got it because we had already talked about the significance of it, and immediately saw the night and day differences. My oncologist, I talked about it with him. He approved, said it wouldn't combat any of the chemo that I was receiving to go after the disease. And I received it on the 5th day. I got it the day before. Woke up the next day after I had spent time at the hospital getting the chemo and noticed a night and day difference. It can't be understated, the difference of my energy levels, the stomach upsetness that comes with these drugs. Just literally from that moment on, of the 12 cycles that I received, from the 5th all the way to the 12th, I got those the day before like clockwork. There was no delay, and just for people down the road that are on the fence about this kind of stuff, I had a well-renowned oncologist, spoke about these infusions that I received here, which is ultimately just vitamins. There's nothing complex about it, other than the fact that it is clearly assisting cancer patients with the blending of modern approaches of medicine with a more holistic style approach, and just bringing them together. And I benefited a great deal from it. From the beginning till the end. I was even receiving them before I had an official diagnosis, just to keep my immune system as high as I could get. And while there's no real apparent way to see what all it did for me in the beginning, we know now that it was definitely instrumental in me reaching where I am today, which is, coming up on a year out from my original diagnosis. I made it through my chemo treatment, 12 cycles. I received scans this past December. We're obviously in January 2024 now, and my scans showed no active disease. So, I am a believer in it. I expect to be receiving these for, the better part of my life as needed, maintenance, and, should I have to fight this battle again, it will be a part of what I do to, get it back to where it is now.
And so Dr. Stevens from Norton's Cancer Specialist is the main doctor in charge of Jacob's care. And it's significant to note that Dr. Stevens was supportive of what Jacob wanted to do. And for the public who isn't aware, IV vitamin C and IV ozone makes chemo and radiation more powerful, more effective, while simultaneously reducing side effects, which then allows people to finish their course of chemo and their course of radiation. So it's a win-win-win. It's, we price it as affordably as possible. And a lot of patients, swear that this therapy helped them a lot with, the myriad of symptoms that go along with chemo, particularly fatigue and nausea and things like that. And, even terminal cancer patients where the conventional cancer doctors say there is no hope, we're able to help people and give them a lot more time than what the cancer doctors projected. So we welcome anybody who's curious, and we really appreciate you, Jacob, for sharing your testimony and encouraging other people who might be in your same shoes.
Oh, absolutely. And thank you for being able to provide it.
My pleasure.